I'm Catherine Sheeran, host of the podcast Horse Tales with Cat. My next guest is an FEI vet specializing in large animals, specifically horses. Maureen Lunney did her undergraduate degree in science at the University of Guelph in Guelph, Ontario. She went on to complete her veterinary college there, graduating summa cum laude. She spent her summers before and during university working as a groom, first at Box Arrow Farms, where Ian Miller was the rider, and ultimately at Millerbrook Farm, which Ian owned himself. This would eventually lead her to taking care of some of the best equine athletes in the sport of show jumping. Welcome to the show, Maureen.
Thank you.
So I want to go back to your early days. I know a little bit about your background, but tell me about where you started riding and what led you down the path of wanting to decide to become a vet.
Well, my sister and I both started riding at the same time, and I think we were like 5. And we lived in the national parks in Alberta, and they had horses, obviously, for the park wardens. And my dad managed to finagle 2 little ponies. And we both used to go riding around on the little ponies. And then he got a horse for us, but the horse was somewhat poorly behaved and it kept jumping out of the horse paddock. So it got put in the buffalo paddock in Waterton National Park. And then we weren't able to ride it anymore. So that was probably the very beginning. And then when we moved to Ontario, Dad got promoted through the national park system, and he ended up as head of visitor services for the national parks, and his position was in Ottawa. So we came to Ontario, and I started riding at a little stable near Cars, Ontario, and rode ponies first, and then sort of was a working student more or less, and rode the ladies' horses. Most of them were thoroughbreds off the racetrack, and did hunters and some jumpers and did all that kind of stuff pretty much until I was done high school. And then in the summers, I went to work and went to Box Arrow first, was sort of the biggest stable I had ever been in. And Ian was their rider. Shirley Prosser owned it. I think she still does. I'm not sure if she's still around with us. She's in her 90s probably, but she was somebody who had been a very famous woman rider herself, and her family owned Revlon, so she had all the famous Revlon horses. And she no longer rode when Ian rode for her. And then through that contact, I met Ian, and I worked for him for a few summers. And through him, I met Jill Henselwood, and went on to work for her as a groom before and during while I was at vet school.
Okay, so it's interesting because you were basically learning with some of the very best. Was there ever a thought in your head that you wanted to go the rider route versus the veterinary route?
I would say that at best I was probably going to be a talented amateur. And I knew that. And, I had pretty good feel, and I could ride a more difficult horse. But I think that science had always been what I was really interested in. And I think I was always pretty clear that I wasn't going to have a career as a professional rider and be a really top rider. So that's why I kind of went to veterinary medicine. And I had been telling my parents since I was about 9 that I wanted to be a veterinarian. So I think it had always been on my radar.
Yeah, absolutely. It sounds like it was a dream if you knew that early.
Yeah. Yeah. Oh, yeah. I always knew that somehow I wanted to be a veterinarian.
And did working with Jill and Ian, did that shape your decision to go and specialize down the route of horses specifically, and then even more specifically show jumpers?
Yeah, and I would say that I always knew that I wanted to do horses. And I enjoy all horses, but I really liked the ones that had a job and that you could help them do their job and you could see their success or lack thereof, more than horses that, were more pet horses or general riding horses. And besides, I mean, show jumpers is certainly what I've done the most of. I've also looked after, dressage horses that went to the Olympics. I've looked after eventing horses that went to the Olympics. But a smaller group of them for sure, more show jumping than anything else.
Okay. And I'm curious because I don't know the answer to this myself. So, as the vet for these horses that go on to these world-class events, do you get to attend with them typically? Are you, because I know there's team veterinarians, but do you also go as the specific vet for a specific animal?
Yes. And it sort of depends on, who it is, what kind of budget they have, that kind of thing. But yeah, most stables, if they can make it work, will take their private treating veterinarian, not just the team veterinarian. Just because the vet that looks after those horses all the time, I mean, you're probably seeing them once a month at least, and you know them, intimately, and you know every single bump and mark on them, and you're sort of probably the best placed person to look after them if something starts to go wrong. The team veterinarians are fabulous veterinarians, but they may not know that horse that well.
Wow, I was going to say that's really fun then. I'm thinking you get to see these
It was.
events from a whole other angle that I didn't even know existed. So I guess then that leads me down the road of out of all of the spots that you've gone as the individual vet, which for you was the most interesting venue?
Oh, that's a hard question.
Mhm.
I'd have to say, can I pick three?
Yes.
I would say the Pan American Games in Rio de Janeiro was really interesting. I really thought World Cup well, actually, now I've got more than three. The World Cup finals in Kuala Lumpur, World Equestrian Games in Aachen, the Beijing Olympics. I mean, those were all just really interesting places to go. I mean, these horses gave us all the opportunity to travel the world and see places we probably would never otherwise have gone to. So it was pretty special.
And what was the biggest pressure for you as the veterinarian at those events, would you say?
Um, just worrying that, they were either going to get sick off of travel or that they would get hurt. And, I think most of the time, they were very fit. They were very well cared for. They were used to traveling. The risk of that was probably pretty low. But I mean, you never want to see a horse get hurt competing in a sport.
Mhm.
And that, of course, was always the concern that something would happen to them.
Well, then that actually leads me into a question that I had on my mind as far as what is considered, I guess, basic veterinary care for an FEI level horse at a competition. Because, as I think we discussed off podcast a few weeks ago, I was asking about the horse that was at the World Cup Champions, Chrome BF, if I'm not mistaken, who was administered sort of a concoction, which sounded like it was a pretty common thing to be used in horses competing at that level, but it ultimately led to the horse passing away. So I was kind of curious, what is sort of, I guess, is there a standard sort of administration of things for the joints and the muscles when they're competing?
That's a very good question, and it's probably one that I'm pretty much on one extreme side of. And my belief is that if these horses are well fed, well maintained, healthy, not overused, the jumping efforts are used judiciously in these horses, that we don't need to be treating them a lot at the competition. They should be there in good shape. A lot of the supplements that we give, like Adequan and Legend and all that sort of thing, there's not a great deal of proof as to the efficacy of those products. So whether it actually makes the horse feel better, which is great, if it makes them feel better, fabulous, or if it's a bit of a placebo effect and it makes the rider feel better, that may also be a positive thing if they have more confidence. But a lot of the stuff that, if people are giving them vitamins, or in the case of the horse that passed away, they gave him intravenous selenium. Normal healthy horses shouldn't need that stuff at a competition. And there are certainly, countries and veterinarians that, in my opinion, I think it's over treating them. And people would disagree with me, I'm sure. But in that particular case, I mean, we know the danger of selenium. If you really believe that the horse is deficient, you can just give it orally quite safely. That was a big risk to take. And unfortunately, that poor horse died. And
Yeah.
that's not acceptable.
No, I just found that very interesting because in that case, it was not the team vet, it was the individual vet, was it not? That
No, it was the
no,
team vet. It was the USEF team vet or the USET team vet.
Okay. Hence not the vet that would have known the horse more
No,
intimately.
and in general, just reading what the owner has published and, just online, the groom wasn't the groom who knew the horse was with the horse and wasn't comfortable with him being treated. He was trying to consult with the owner. He kind of got, shoveled into the treatment stall, and the horse got treated without them really understanding why or what they were giving the horse. And unfortunately, the outcome was, obviously a fatality.
Yeah, your worst possible outcome.
Yeah, worst probably. I mean, I can't imagine how horrifying that was for everyone involved, including the veterinarian who administered the injection.
So then that leads me to, so what would be considered sort of regular maintenance for a horse at that level? Because I'm fascinated these days when I'm talking with, even other amateur riders, the kind of things they do for maintenance. So two of my questions for you were going to be, one is what's considered general maintenance for a horse jumping at that level, the FEI level, and what would you consider normal maintenance for a horse doing, say, the meter 10 level?
I don't think it really makes any difference what they're doing. I think that what we need to be doing as a profession is examining the horses, doing a really good clinical examination, and deciding what each individual horse needs. And I think a lot of that has gone by the wayside, and people seem to have some sort of a formula where everything in the barn gets its coffin joints injected or its hocks injected or gets Tildren or Osphos, and they're not basing it on a clinical examination and the findings in that particular horse. So really, whether it's an FEI horse jumping 1 meter 50 or 60 or your amateur horse, it's what that horse needs. And some of those horses jumping gigantic jumps are super sound and they don't have a problem in the world, and you shouldn't be sticking needles in their joints. And some of your amateur horses are maybe older or more experienced, or they have more miles on them, or they weren't sound to start with and they may need more help. But it should, to me, be very specific to the examination of the horse. If you can't, make a clinical case for treating a joint, then in my mind, you shouldn't be sticking a needle in it. And unfortunately, that's not what happens a lot of the time, as you're probably aware. People decide that they need maintenance, like it's your car and you have to change the oil. That's not the case. If you went into your doctor's office and said, I feel fine, but I think in the future my knees are going to hurt, so inject them, I think they'd probably throw you out the door. Like it wouldn't happen. And we've normalized that kind of thing in the equine industry. And I don't think it's good for the horses, and I don't think in the end it's good for the veterinary profession. So
Fair
I'm
enough.
hoping more people think about what they're doing and why, and base it on a really good examination of the horse rather than just arbitrarily treating something because everybody else does.
Yeah, because I feel like you can really chase a problem with it when you haven't really diagnosed what it is.
Right. Yeah, and coming to some sort of a diagnosis, and everybody's budget is different too. I mean, and I'm not against if we haven't been able to figure it out. I'll tell them that I'm willing to play mad scientist, and this is my best educated guess, and do they want to try? And some people will say yes because they don't want to keep investing in, looking into making a final diagnosis, or we've tried the basics and it's not working and they don't want to have an MRI, or and they just want to try treating what seems the most logical thing to treat and see what the result of it is. And I mean, that's valid too, because people ultimately have to pay the bill. But I think too many people don't even start the process of doing a really good clinical exam in the first place to even know where they should be treating.
Well, that leads me to a question that I had, which was, how does anxiety manifest in horses? Because I think sometimes, again, behavioral issues will come out and we don't know why. And sometimes it's anxiety and sometimes it's a physical problem. So, beyond things like ulcers, which are kind of the obvious, what other, I guess, indications would you say there are for anxiety?
And that is also a good question. And it's one of the hardest things that you're presented with is a behavior problem, and trying to decide, is it purely a behavior problem, which it very well could be, or is there some component of discomfort and that's why the horse is behaving that way? And that is probably most sport horse veterinarians. I mean, we probably spend at least 25% of our time trying to figure out behavior versus discomfort. And it's not always easy, horses, you're using the word anxiety, but horses, for whatever reason, are having a behavior problem. I mean, they might be bucking or spinning or rearing or excessively spooky or stopping at the jump or refusing to do a lead change, that kind of thing. You have to try and rule out the physical first. So again, really good clinical examination, go over the horse, sometimes giving anti-inflammatory trials to see if it changes the behavior can help. Obviously that doesn't help if you have ulcers, but if they have sore hocks or sore back or anything like that, sometimes giving them pain relief, if it makes a big difference to them, you need to keep looking that there's something there that's causing that behavior. We work with saddle fitters, physios, chiropractors, we all try and see if we can find something that would explain the horse's behavior. Sometimes it is purely behavioral. And sometimes when it's behavioral, it's rarely the horse. It is almost always the rider or the trainer. And sometimes that can be really hard information to share with them without making it sound like you're, accusing them of something. I mean, you're trying to help them. But I mean, sometimes horses that don't do lead changes, if you watch people ride them, you understand why. They're not through, they're not straight, they're not, there's reasons in the riding that you can clearly see are causing some of the problems. Sometimes it's a matter of an inexperienced horse or a horse that doesn't have a lot of confidence and they've been rushed through the levels. That can certainly cause them anxiety. It's like socializing puppies. Like if you haven't explored all the different venues, if you haven't exposed them to all the different things and the noises and the sounds and the flags flapping, and, sometimes they just can't do their job because they're just overwhelmed. They're reacting to everything in their environment. So, sometimes that kind of behavior, people don't want to step back, but sometimes you need to simplify the job for the horse until they're confident at the level that they're at and then progress. And I think the same thing happens with riders. There's a lot of push to jump bigger, go faster. And sometimes the riders also don't seem to want to be told that, until you're 95% competent at the level that you were at, perhaps you should not be jumping bigger jumps, because you're putting your horse in a position where you're making too many mistakes. And those horses, they don't want to hit the jumps and they don't want you chucking them in the teeth or getting left behind. There's a lot of things in that ride that is making the horse anxious and upset because it's not going well. So it's a big picture, and it involves me and the other healthcare professionals and the farrier and the trainer and sometimes the mother, and everybody gets involved. But it's probably one of the hardest things to do, and it's one that you hate to come to the conclusion for the horse's sake, and you don't want to miss it if there is something physical causing the problem. Like you don't want to jump too quickly to well, it's the riding or the training, you want to really be sure that there's not something you can help with.
Mm-hmm. Mm-hmm. Yeah. So I would say there's probably an extra bit of pressure on you when that's happening,
Well, you
because
have to
as
be
you,
very diplomatic sometimes.
no, I find that fascinating, because I've had this conversation with a number of riders recently, that I feel, to your point, that a lot of riders coming up through the ranks today do seem to want to jump from,
Big rush.
yeah, there's a big rush to get right to the Grand Prix without having the basics in between. And I think, there's so many lessons that you need to learn along that road that can't be rushed. And
Right.
as you say, ultimately it's the horse that suffers, because you really can mess with their confidence. And as
Yeah.
you said, if they're a horse that's careful, things are going to
Bad
happen.
things can happen. Yeah.
Mm-hmm,
I think,
mm-hmm.
you're right and some of the riders that have already mentioned it, is a lot of the younger people coming along, they don't learn on green horses or young horses. They get purchased a horse that knows its job. And they don't necessarily learn that skill. And it's something we have in North America. We don't have a lot of people that can train and bring along young horses successfully. The Europeans are famous for being good at it, and we're not particularly. And some of it comes from our system, where we put our young people on really well-schooled horses, and then the trainer keeps riding them and training them, and they just kind of get on and jockey themselves around the ring, but they're not really learning the skills of how to help a young horse who maybe isn't as confident or is having difficulty, or they don't have that skill set.
Yeah, I was just thinking, your own background and the fact that you've worked with riders at this level, it must give you a bit of an edge over some other veterinarians, would it not?
I think
Because,
it's a huge, you have to understand the sport, and you have to be able to observe what the rider's doing, how it's affecting the horse. Yeah, I learn more sitting at the warm-up area, watching people warm up, or going and listening to somebody's dressage lesson, um, than you just about learn anywhere else. And you can really see how the rider affects the horse and what changes can be made. And I think it's an ongoing, lifelong, you're always learning. And
mhm.
you're not paying attention.
And how would you say you incorporate other health practitioners? Because another thing that was new to me in the last couple of years, not that I hadn't been exposed to, say, massage therapists and chiropractors, but I'm finding, again, at my level, I was meeting, other amateur riders that have a regular regimen of, massage therapy and chiropractic once a month. And I was thinking, I don't even know how they afford this, quite frankly. But I was also wondering, do you feel that that kind of maintenance is necessary, or only if you've seen some sort of physical problem? Like, what's your take on that?
Probably the ancillary healthcare providers are going to hate my answer, but I think that generally speaking, unless there's a specific problem that you're working on, I don't think that is a necessary thing.
Mm-hmm.
Probably more horses adjust themselves well bucking and rolling in the paddock than a person standing, can do. If there's a specific problem, sometimes I have had, good results, and I think massage therapy more than chiropractic. But a normal, healthy horse without a specific problem, I think it's just like normal, healthy people. You don't need to always be going and having a treatment if you're otherwise fine.
Mm-hmm. Mm-hmm. Fair enough. So another question I had, that was along the, I guess, the vein of what you would be using in maintenance is, I know that there was a big article, I think it was in Chronicle of the Horse, that was talking about progesterone that was being used in stallions and geldings. And I didn't even know this was a thing till somebody
That's
brought it to my
actually,
attention.
you can't do it because it tests positive in those guys, and they're not supposed to have it.
Okay.
So
But
people still do it. But
and what were they using it for? Because my
makes
understanding is
them quieter. Yeah. just, progesterone is the feel-good pregnancy hormone. So basically, if you have progesterone, you tend to be more mellow and calmer and less stallion-like. For sure, in geldings and stallions, there's allowed blood levels. And so theoretically, they should be able to catch them, and it is illegal to use them in males. You can use it in mares legally.
Okay. Yeah, because I thought I'd read somewhere that it was now being banned, but I didn't even realize it had ever been used, period, for male horses. I'd only known of it in mares that had,
Right.
hormonal issues.
Yes. You weren't trying to make your hunter quiet.
No, exactly.
Yes.
So I was also curious about when I was asking about how anxiety manifests in horses, I also wondered how some horses internalize anxiety. Just wondering what you've seen as far as, I guess, physical, issues. Are there any?
Well, gastric ulcers for sure. Just general tension, muscle tension. They can be quite, like, horses will get hot. They won't relax. I mean, you can tell when you're riding them that you never get relaxation, that they're always a bit tense and worried. And I mean, horse people, we know how our horses feel pretty easily just by looking at them. And you can see when they're tense and they're upset, or when they're calm and they're relaxed. And I think that physically, it probably, if they're tense constantly, if they don't have true connection, they get sore necks, sore backs, muscle soreness, ulcers. It's just kind of, it's your whole body being tense all the time.
Fair enough. That makes sense. And then what would you say you see today? I was curious whether you see a difference today as far as tissue or muscle injuries in, I guess, for two reasons. One is there's the change in the footing. Today's footing is very different from what it was 30 years ago. I'm wondering, does that have any implications as far as what are more common as far as injuries? And then the other question I had along that same vein is, now that horses at these higher levels are jumping, it seems to me, higher heights than they used to jump in the old days, or at least it seems like there's more technically difficult courses at those heights. Do you see a difference in the types of injuries, again, that you're dealing with horses?
It's interesting because I also thought that horses jumped higher now, and somebody pointed out an article not that long ago that actually, like the Mexico Olympics, the jumps were bigger than they've ever been since. So I thought that was interesting. I would say with the all-weather fiber sand footing, what you have at home would be very different than what they put in a show ring, because the footing in the show ring is a different consistency, because they have to have hundreds of horses go over it and not dig it up. So it tends to be a bit harder. I would say the one thing that I notice is that you get more sort of concussive issues, coffin joints, front pasterns, ankles, that kind of thing. You have less soft tissue injuries. You see often when the horses go on grass, like when they go at spruce, they get sounder. They love the grass on their feet, but there's more often a soft tissue injury, just because there's more give to the footing, maybe more collateral ligament injuries, that kind of thing, just because they've trained so much on the fiber sand, which is always flat. I think sometimes their soft tissue structures become a bit weaker over time. And I'm kind of an advocate for working, even any show horse on different surfaces, different gradients, take them hacking, get them out on other footing, that kind of thing. Because I think if you just constantly go on firm level fiber sand, it's just like us only ever walking on concrete. And then we go out and try and go running through the woods, and we're turning our ankles over and tripping. And, I think it's good for the horses to be on all sorts of surfaces. And that's also why I'm a big advocate for them to get out in a paddock and be outside and moving around all day, and not be, stuck in a stall. Because I think it makes them stronger and sounder.
Yeah, it makes sense, because I do find myself, as I age, it seems to me that the more I move, the better I feel.
Yep. Yeah. So and horses were designed to walk. I mean, wild horses 35 to 50 miles a day. So us getting on and trotting around, for 20 minutes while we look at our cell phone, it's not cutting it in terms of exercise and movement. And a lot of horses, they don't get as much turnout as they should, or we're limited in the amount of room that we have, they're in smaller paddocks, that kind of thing. So I think we really need to make an extra effort. If we don't have good turnout for them, is to get them out twice a day, or take them walking, or take them hacking.
Yeah, and actually that leads me to ask you about what do you think about all night turnout versus daytime? Is there any belief, because I've heard this, that there's a bit of anxiety for horses being out at night because of the fight or flight response, or is that really not an issue?
Yeah, I don't think that's true. I think during the day, obviously the flies are a problem, the sun can be a problem, the heat can be a problem. At night, you've got more mosquitoes. I think the biggest thing of the difference of the two is how confident people are about their horses being unsupervised overnight. So you want to have horses that are well behaved, not climbing over the gate or beating each other up, or, especially if there's groups.
Yes.
So I think that's more the big thing, is how comfortable are you in your horse's behavior and the circumstances of your turnout, that you feel confident leaving the horse out there without people around, because generally most stables do not have night staff to monitor them.
No, they definitely do not.
No.
And then getting back to when you were talking about injuries, I was curious as to how often do you feel like the blacksmith can make a big difference in terms of how sound the horse is? Do you feel okay? Yeah. Huge. So speak to that a little bit, because I was kind of curious. I don't know how often, where I've been, that the vet and the blacksmith are communicating. So just wondering how does that conversation go, and what kind of suggestions would you make? I mean, obviously this is a big generalization, because we're not looking at a specific problem, but just wondering how that could impact things for a horse and rider.
Well, I think a good blacksmith makes it or breaks it. Like if you have a good blacksmith, you should treasure them and do anything that they would like you to do for them, because they are amazing and they can make all the difference. I think that, in the higher level horses, we might be consulting on the shoeing every time they're shod. We often take x-rays just for the farrier to address foot balance.
Oh, wow.
We might do that every few months, just so that they can see, where's the coffin bone, where's the pasternal line, where's the foot capsule, that kind of thing. So, and, in my practice, if we're having a problem with the horse, we also discuss it with the blacksmith, and we talk about how can we change the shoeing, how can we make the breakover better, how can we ease the horse's discomfort from whatever it is he has with the shoes or the angle, or sometimes we put fancy pads that absorb more concussion, or we change the breakover in the shoe so that they roll forward more easily, or we give their heels more protection, so it's an ongoing conversation with them. And with most of them, if it's not every shoeing, which is every 4 or 5 weeks, it's every second or third shoeing, like it's constant.
And what would you say constitutes a good blacksmith, to your point?
I think they have to be really good horsemen or horsewomen. I think they have to have a really good eye for the balance of the foot. Their training in terms of, anatomy and conformation and the different materials at their disposal is ongoing. They do a lot of continuing education. And then I think the biggest thing is just experience, because every horse is different. No leg is straight. So they need to have just experience of shoeing a lot of horses. And they get, the cream will rise to the top. Like you'll start to see the group that really is excelling at what they do.
And then along that same vein, I was wondering, is there ever a thought in your mind that horses should be going barefoot for periods of time? I just wondered, because I know that sort of became a thing. the Tokyo Olympics, I believe there was one team that was showing barefoot, if I'm not
Yeah.
mistaken. And I just wondered what would be the advantage, disadvantage of doing that.
It really depends on the horse and the quality of their feet to start with, but I do actually think that being barefoot, if the horse's foot will tolerate it, is a very good way to maintain the health of their foot. Because it allows the hoof capsule to expand and contract the way nature intended. It allows more pressure on the bearing surface of the foot and the frog, which is also as nature intended it. On the fiber sand footing that we have, most of them, if they have a good strong foot, can go barefoot because they're not going to slide or slip. If they're on any other surfaces, usually they need a shoe on just so that we can put corks in and that they have grip and they're not going to slide all over the place. Some horses just have poor foot structure and they're never going to be able to be barefoot. They need the shoe in order to support the size of the horse doing the activity that it's doing, which is landing off a big jump, that kind of thing. If they have a good, healthy foot and you can get them barefoot, I think it's fabulous.
Okay.
And again, I discuss it with the blacksmith. I mean, they're the ones that look at their feet all day, so they would have probably the best idea if the horse would tolerate it or not.
So now I kind of want to shift gears and ask you about a few of the riders you've worked with over the years. I know Jill Henselwood is one that you've worked with
a lot of time.
a lot of time. And I was wondering, I guess, what are the horses that are most memorable for you in terms of with Jill or with any other riders that you've worked with? I know that you have a special bond with Special Ed. I'm not sure that everybody knows that both you and Sandy Patterson go and see Special Ed every day, taking care of his needs. And I think he just turned 30, did he not?
He turned 30 on April the 14th. And we didn't actually know when his birthday was until this year. And I had a young horse at a stable in Germany, and the guy there was, one of the people that's quite involved with the Oldenburg Horse Society, and Ed is in Oldenburg, and he found the guy that went to the basement and found the file cabinet and pulled out files on these horses before they were computerized. And he found the horse with Ed's breeding and the color and the markings and all that kind of stuff. And it was the only bay colt, and figured out what his birthday was this year. So we actually managed to find that out. And I owned and own part of Special Ed.
I never knew that.
Yep. And when he retired, he was 18, and I've pretty much looked after him most days ever since. And Sandy started helping me, which was fantastic because it's a lot to do every day. And he's in a lovely stable, Lone Wolf Farm in Burt's Rapids. And they do a great job. The stalls are nice, the water is clean, the hay is great. They notice if something's wrong. They bring them in if it's hot. They have a paddock with the retirees in it, and they take extra special care of them. But they don't do the grooming or the foot picking or that kind of stuff. So, and he gets some medication that we give him because he's cushingoid. So either I go or Sandy goes, pretty much 7 days a week, and he gets groomed and he looks fantastic. And his farrier, Terry Osborne, still looks after him. And he's great. He looks wonderful and he's happy and he's healthy.
So he's clearly one of your favorites. Who else
would clearly my favorite, yes. He was my heart horse from the very beginning. I met him when he was 6 and he was at a dressage barn. And it was a client of mine, and I liked him the first time I saw him. He was just a lovely horse. And I really, there were a bunch of horses I really liked. Canadian Colors, which you remember. Murphy Brown, who went to Mexico. George, who was the horse that she took to the London Olympics. Claire Smith had one called Master Singh and Gordon Gibbons, which were really nice horses. There's so many nice horses. I love 007. You would also remember 007.
I do.
Yeah. He was lovely.
And what's probably for you the most challenging part of what you do?
The people.
Mm.
The horses are easy.
So you and trainers would have a lot in common.
Yes. Yes. And it's trying to balance everyone's needs, because people have agendas for horses, and sometimes you feel like that's a reasonable agenda and something that you can support and try and help with, and sometimes it's not an agenda that you think is appropriate or possible, and trying to bring the people around to your point of view sometimes is a difficult part of the job.
Mm-hmm, mm-hmm. And what's your favorite thing about what you do?
The horses.
Mm-hmm.
It's pretty amazing to get to spend your life hanging out with animals that you love. And yeah, I mean, there's very few. I can only think of maybe two horses that, I just didn't like, and the rest of them I all pretty much like them. And I like the sort of the detective aspect of figuring out, I think I would have been a good detective. So I think that going through that process of trying to figure out what's going on with a nonverbal patient, it's intellectually interesting.
Well, it's interesting because I remember years ago riding a horse that had, he was blind in one eye, and we did not know as the riders because he had so,
He'd adapted.
He'd adapted. And then I remember you on a blackboard explaining to me exactly how it works. So I thought you weren't just good at the science, you're also good at translating that into layman's terms, which I think probably makes you very good at what you do. And then my other recollection is just, back in 2018, I had to put down one of my horses, and you were the one that did it for me. That was one of the hardest things I ever did. But I would have to say, I've always said to people since, you did make it the most beautiful experience it could have been for that animal. It was, no,
I
you were
try.
like,
I mean, I think it's the one thing that any veterinarian wants to go really well. Like, it's the one thing veterinarians we worry about the most is that euthanasia, which basically means good death, is you want it to be a good death. You want to do it as well as you can and have the animal as relaxed as you can, and support the people around them as much as you can, because obviously, as you know, everybody's pretty emotional and upset, and it's a very hard thing to do. It's hard to make that phone call. It's hard to schedule that appointment. I appreciate how hard it is.
Yeah. So no, I would just say kudos to you, because I think that, that's again another gift that you have shown in terms of what you do. And I would say, is there anything kind of left for you on your bucket list as a veterinarian that you would like to do? I asked this of all the riders and the course designers. I was just curious, is there any, I don't know, event that you haven't gone to, or sort of any special challenge that you haven't faced with an animal yet that you would like to experience?
I think the one thing that comes to mind is I would like to be more involved with the sort of the veterinary aspect of the FEI in terms of welfare of the horse. That's really important to me. And I think we could do a better job than we do. I mean, everybody's always striving to do the best they can, and people are in this because they love horses and they want to do the best they can. But I think there's clearly room for improvement. And that's something I would like to get a bit more involved in.
I'm sure that's something that you can possibly pursue.
Yeah, I think there's room for, some voices to come forward and sort of start trying to remodel how we look at our sport. And I think we need to do that as a group of horse people and in the sport, because we're starting to get more criticism from the outside of the sport on animal welfare and everything else. And I think we need to improve that as best we can.
Well said.
Thank you.
Well, thank you, Maureen. I really appreciate your taking time out to meet with me today. And I wish you all the very best in the future. And I'll look forward to seeing you at events to come.
Thank you. And I think your podcasts are amazing. They're really super interesting. Not just mine, obviously, but the other ones that I've listened to, I've really enjoyed.
Well, thank you.
Thanks.
If you would like to learn more about the podcast and upcoming guests, please follow me on Instagram and Facebook at Horsetails with Kat.